As the public health care system continues to battle a nursing shortage, Health and Wellness Minister Dr. Gov't said government is looking to bring on around 70 nurses that are expected to take final exams in May.
I learned that an additional 71 nurses will be doing their final exam somewhere in May, which would mean that the government would brought on an additional probably 100 nurses. You know the challenges. There's always recruitment going on in the country for nurses to leave the country to go abroad.
Upon taking office, Dr. Darville said there was a nursing shortage of 140 specialty nurses. Since then, he said 31 nurses were brought on from the University of the Bahamas. But as the public health care system is constantly used by other countries to shop for nurses, the health minister says government is looking at ways to sweeten the pot.
Well, we're looking at the salary scales. I don't want to sit here and say that we have an exact plan on the way forward, but we're looking at all the necessary avenues. I believe that some of the compensatory packages for our nurses need to be looked at so that we can become more competitive. There's many other things that are necessary.
The Health and Wellness Minister added that government is in talks with the Bahamas Nurses Union. But one thing is for sure, he said if nothing is done, the end result won't be good for the country.
Negotiations must begin to ensure that we are in a position to ensure that our nurses stay at home. And that requires better compensation, other means of compensation, better facilities, improving the healthcare infrastructure so they're working in a better environment, and the list goes on and on. And so we're looking at all those areas, because if we continue to have this brain drain where we train and then they exit the country, it's not good for healthcare.
His comments came on the sidelines of the launch of a training session for 50 patient care assistants. He said the first part of the training is soft and attitude transformational skills.
After this training is completed, we're going to be doing some in-house training for our patient care assistants, which will last somewhere between 3 to 4 months. And from there, they will be deployed at various clinics and the hospitals here in New Providence.
Reporting for the Guardian News Network, I'm Berthany McDermott.